Everybody is talking about SMAS. A lot of my patients ask me, what is this SMAS talking about? Like deep plane, SMAS lift. What's the role of SMAS? I'm Dr. Kevin Sadati, board certified facial plastic surgeon practicing in Newport Beach, California. SMAS is like a scaffold that holds the tissue. So the skin is actually attached to the SMAS in a layer superficial to it, and it would get dragged down by the SMAS. SMAS is SMAS, Superficial Musculoaponeurotic System. It's a plastic surgery term. It's a mixture of different tissues that form a layer of tissue that starts from scalp here, goes attached to different part of the bone and deeper tissue all the way down to the neck. So let's talk about this part of SMAS, which is temporoparietal fascia, which attaches to this part of skull and then comes attached to this bone. It's called zygomatic bone. So this muscle obviously moves some portion of the deeper tissue. The same SMAS starts again from here, attached to this bone, and goes around here, back here. It's called non-mobile SMAS. See, it does not move. It's firmly attached to the deeper tissue. Nobody comes here telling me, oh, I have a lot of loose tissue here. Actually, no aging occurs in this area, I mean deep tissue laxity, because it's very firmly attached to the deep tissue. There's a parotid tissue and other tissues in the neck area that's firmly attached to it. Little anterior to that, here, if you can touch it, it's called mobile SMAS. So from here forward, it's called mobile SMAS. See, it glides and moves. So there are ligaments that holding the SMAS here in this part of the face and in the neck area. And the rest are anchored to this area. So when you're young, that SMAS, which is combination of fascia, muscle, fat, is firm and tight like this. As we start aging, as a result of sun damage, hormonal changes, genetic factors, medications, certain diseases, weight loss, weight gain, that strength, again, in collagen and elastin decreases and becomes stretched out. So the tissue that was firm like this, the SMAS, it becomes loose and pulled down by gravity. So the tissue that was in your cheek is going to hang out here from the nasolabial fold. The tissue that was here is going to hang out here. Some people, even their buccal fat, that when they were younger, they had full cheeks, the buccal fat descends and hangs out somewhere here and accentuate their jowls, and then also dragging the corner of the mouth down. And also this part, which is platysma muscle, the part of SMAS, start descending, and as age goes on, we start seeing those 11s that they call it bands. Those are platysmal bands that they start hanging down. And also there are some muscles underneath that they get loose, and you start seeing the fullness in the neck area. So that's the SMAS in 2 sentences for you guys.